Tuberculosis is the leading cause of death worldwide. According to the World Health Organization, over 4,100 people die from TB and nearly 30,000 people fall ill with TB disease. Today on the program, we will take a look at care for this disease and how to prevent further spread. My name is Olasumbo Modupe. You're watching Soundhealth on Lagos Television. The conversation begins after COVID-19 update. Please stay tuned.
Fully vaccinated inbound travelers into Nigeria will no longer be required to take a pre-departure PCR COVID-19 test. According to the federal government, this would however be subjected to rapid antigen test at the airport by the NCDC within the arrival hall of the airport free of charge. The decision was coming after complaints by many travelers over the cost placed on the PCR test. The Secretary to the Government of the Federation and the Chairman, Presidential Steering Committee on COVID-19, Boss Mustafa, added that passengers who are unvaccinated or partially vaccinated are mandated to take a COVID-19 PCR test 48 hours before departure or do a Day 2 and Day 7 test on arrival, noting that such passengers must pay for the tests. Mustafa revealed that this directive would take effect from April 4. COVID-19 testing in government laboratories remains free of charge for public health purposes, while testing for personal purposes such as travel are paid for by individuals and conducted in private laboratories. The Nigeria Center for Disease Control in a statement clarified that the Nigeria International Travel Portal was developed by the private sector and is managed by Nigerians in the public sector as one of several measures introduced to limit the risk of importation and spread of COVID-19 in our country. Despite challenges in the functionalities of the site, mostly related to payments using foreign cards, no funds for private testing are received by the agency.
It is still Soundhealth on Lagos Television. Joining us via Zoom this evening is Dr. Victor Adepoju, Project Director, HIV and Viral Hepatitis Self-Testing in Africa Project, JPHEIGO in Nigeria. Thank you so much for obliging us and joining us this afternoon. So Adepoju, tuberculosis is still the leading cause of death worldwide before the pandemic. Tell us, how do you tell you have tuberculosis?
Yeah, thank you very much. I guess the question is TB happens to be the leading cause of death from infectious disease before COVID, and what the impact of COVID has been on tuberculosis. Am I correct?
Yes. And how do you tell you have tuberculosis?
So I think I would say COVID has had the most impact on TB in terms of diagnosis, in terms of outcome. Before 2020, before the COVID pandemic in 2020, tuberculosis was leading. Tuberculosis mortality has been reducing year in, year out. Unfortunately, for the first time in 2020, we have a spike in death from tuberculosis, which has set us back a decade backward. We have been witnessing systemic reduction until 2020 because of COVID. It's not far-fetched. The reasons are not far-fetched. The resources that was meant for TB at the wake of the epidemic was redistributed to COVID-19. For instance, the machine that was supposed to be used for tuberculosis testing also can be used for COVID, and that machine, the priority was given to COVID testing rather than TB. So you see a lot of people actually die because of underdiagnosis in the COVID era. The same way for human resources. Most of the human resources working in infectious disease TB unit were also reposted by many governments because of the shortage of human resources were redistributed to COVID management center. So these are some of the resources. Also,
Dr. Adepoju, thanks for the update. I would like to know now, how do you tell you have tuberculosis and not whooping cough or any other condition that is related to this disease?
So basically, the symptoms of tuberculosis are four basic symptoms. The first one is cough, usually cough that has lasted 2 weeks or more. Usually, most people would have gone to informal providers like paper medicine vendors, community pharmacies, or even some traditional medicine practitioners. And despite all these medications, the cough has not subsided for 2 weeks. It has been ongoing for 2 weeks or more. That's one of the big major cardinal symptoms. Usually, at that point, we won't say that person has TB already, because the person still needs to go for confirmatory test. However, at that point, you can say that person is presumptive. In other words, presumed to have TB. We also have weight loss, and we have night sweat, and we have fever. So these are the four cardinal symptoms of tuberculosis. However, depending on the part of the body that is affected, we can have other symptoms. For instance, if it affects the bone, whether the joint or the bones, you can have pains. You can have joint pain, you can have bone pain if it affects any area of the body. If it also affects the brain, you can have things like seizure. The person might be having seizures. The person might be having very severe headache. The person might even have a complication, convulsion. These are some of the other symptoms that an individual with TB. However, that person can also have what we call hemoptysis, in which case that person will be coughing out, but that cough will be stained with blood, and that is usually at the end stage. We don't want patients to get to this level before the diagnosis of TB is made. So, a high index of suspicion is needed. If anybody is having cough of 2 weeks or more, is having fever, is having night sweat, is having weight loss, these are some of the pointers that person may be having tuberculosis. However, the person still need to go for confirmatory test in the hospital, either by chest ray or using GeneSpace test or microscopy to find out and confirm the diagnosis of TB.
Okay, you've let us know the symptoms of tuberculosis. What causes this condition in people?
Okay, the cause of tuberculosis in people, right?
Yes.
So I think the major cause of tuberculosis is a mycobacteria that we call Mycobacterium tuberculosis. So it's usually present when an individual who has TB coughs or sneezes, or even sometimes singing. During these activities of coughing to the air or singing or even sneezing, there are what we call aerosols, like bubble, and those bubbles contains Mycobacterium tuberculosis. So they are released into the atmosphere during this activity. And an individual, or suspecting individual that is just passing across, can inhale this aerosol, and then this aerosol can get to the respiratory tract. Unfortunately, tuberculosis, this aerosol, this organism can stay in the body for up to 10 years without showing any symptoms. However, there are some conditions that when that person now has, it can now facilitate the progression of what we call latent tuberculosis. So that organism can be inhaled and stay there for up to 10 years, what we call the latent tuberculosis. That person will not show any symptoms until later that person cannot progress to active tuberculosis, in which case that individual will begin to have some of the symptoms I've mentioned earlier. And there are some things that can predispose an individual from going from latent tuberculosis to active tuberculosis. For instance, an individual who has other immunosuppression like HIV/AIDS, or is having diabetes, or is having any form of organ failure in the body. Those kind of individual, malnutrition, those kind of individual can progress earlier, even within weeks. Those individuals can progress from latency to active tuberculosis and begin to show symptoms.
Okay, Dr. Adepoju, the symptoms and mode of transmission is similar to COVID-19, the coronavirus. Now, how aware are people, and how do we prevent or protect ourselves from getting this disease?
Yeah, thank you very much. This is a very nice question. And I think we just need to continue some of the public health measures that government has recommended for us. The government of Nigeria will still continue to talk about basic infection control, for instance, the use of masks, avoiding overcrowded environment, and cough etiquette is also very important. When an individual wants to cough to the atmosphere, there is a particular cough epithelium in which you can go with your elbow. Use your elbow to cover your mouth when you are coughing. Also trying to hospital, there's what we call the fast tracking policy, in which case, especially in the waiting area of the hospital, healthcare workers need to be sure that people don't wait for a long time in the hospital, the waiting area. It's not overcrowded, there is adequate ventilation, and the individual that is coughing in the crowd should be fast-tracked by healthcare worker so that he can be fast-tracked and be quickly seen by the medical doctor, and so that individual can leave the hospital environment as fast as possible. So these are some of the basic hygiene and infection control that we need to obey, and we also need to make sure that we get ourselves vaccinated, especially for COVID. Vaccines are very, very effective. The same thing for TB. We also have vaccine that is called BCG vaccine that also have some level of efficacy, especially to prevent a serious form of tuberculosis later in life. So mothers also need to ensure that their babies are given a BCG vaccine when they are young. And adults or wherever is also very important that we go for our COVID vaccine in addition to this public health infection control measures that I've mentioned.
All right, is tuberculosis treatable?
Yes, tuberculosis is treatable. That's a good news. With basic treatment for just about 6 months or thereabout, the individual can be treated fully and be cured. It's actually cured. We use the term cured for tuberculosis. In other words, after 6 months, there's a possibility that an individual who was initially diagnosed with tuberculosis, if he's very adherent to that 6 months medication, it's a daily medication and it has to be taken. It has to be taken for the full 6 months. That individual, there's a possibility that individual will get better after 2 weeks or even after 1 week of medication. However, that person must not stop the treatment. He must be adherent and make sure he takes this drug daily for a period of 6 months. After that 6 months, there's a possibility that if he goes for a follow-up test, the organism, Mycobacterium tuberculosis, will no longer be found yet. So it's possible. It's curable. Tuberculosis is curable with about 6 to 12 months of treatment. That person can be cured, depending on the type of tuberculosis. All types of tuberculosis, except tuberculosis that affect the joints and the brain, can be cured over a period of 6 months. However, for tuberculosis involving the bone and the brain, the treatment is for 12 months, and that person can become cured.
All right, the theme for World Tuberculosis Day in year 2022 is Invest to End TB, Save Lives. How do you think we can invest in resources to ramp up against tuberculosis?
Yeah, thank you very much. There's a WHO data that has said that 1/3 of the world population is already infected with tuberculosis.
Wow.
In other words, I don't know what the global figure for the world population is now. The last time I checked, it was 6 billion. So what that means is that about 2 billion people in the world are already infected with tuberculosis. However, I mentioned latent tuberculosis before. Most of these people may not be showing any symptoms. They are still in the level of latent tuberculosis. So how do we ensure that we prevent the development of active tuberculosis? That's the question. The first thing is to make sure that all this take basic hygiene, basic infection control. Like I said, avoiding the crowd, covering our mouths when we are sneezing or coughing to the ear, fast-tracking patients in the hospital, avoiding overcrowded environment, designing our houses or hospitals so that there's adequate ventilation. These are some of the basic things I've mentioned before that we can use to prevent it. However, there is also the medical prevention, in which case we can use drugs also to prevent tuberculosis. The drug that we were using before is called isoniazid. However, you have to check very well that person don't have activity. You don't give this prevention medication to an individual who is already symptomatic, who is already showing symptoms. You only give it to somebody that is not having any active symptoms of tuberculosis. So that is very important to screen that patient properly before you give this drug. The name of the drug is isoniazid, and that person will take 300 milligrams daily for 6 months. And we usually give it to people living with HIV who don't have active tuberculosis. So we don't want them to develop TB. So we give them this drug usually for 6 months and can protect them for another 2 to 5 years from having tuberculosis. However, recently we even have new medications for prevention of TB with shorter duration of treatment, just about 3 months, which is rifampicin and isoniazid RH. Just take it for 3 months as opposed to the 6 months of isoniazid. So these are some of the innovations, new drugs to prevent tuberculosis. And it's important that government and donors also scale up this medication so that we can manage tuberculosis from prevention perspective, so that people don't have to develop these active symptoms before we
All right, talking about HIV, tuberculosis is the leading cause of death in people living with HIV, and it is also a major contributor to antimicrobial resistance. How do we change this narrative? How do we ensure that people living with HIV get proper care?
Thank you very much. It's very sad that TB still remains the leading cause of death among people living with HIV. And the reason is obvious. It's a what some people will call double burden of disease. So HIV itself has the capacity to bring down the immunity of an individual. So when that person has TB, it's a double tragedy, and we try as much as possible to prevent it. So how do we do this? The first thing is what we call we need to implement what we call the three I's of prevention. So the first I is infection control. Like I said, HIV are the major thing in the hospital. We have to make sure the hospital, the clinic is arranged such that there is no overcrowding. Because even within the larger population, HIV are at a higher risk of developing TB. Some of these risk factors than the general population. The second thing is what we call active screening. You have to make sure we screen every person living with HIV at every clinic attendance. That question, those 4 cardinal symptoms I mentioned before, healthcare worker needs to ask them routinely for every clinic. Because, for instance, last clinic you come 3 months ago, you may not have cough, you may not have weight loss, but this clinic you come today, those symptoms may be there. So there is a need to actively screen them for every clinic. And also, you ask about how do we prevent resistance, which is also another major problem of tuberculosis. So the first thing is that fake drugs are common for tuberculosis. There are so many fake drugs in use that are not approved by the government. All these things need to stop. The regulatory body needs to put an eye on any shop or any retail outlet that is selling loose medication. The actual medication for tuberculosis is what we call a fixed drug regimen. Just like you have drug for malaria, it's like a 3-in-1 drug. It's a single tablet, but it has several medications. The same thing for tuberculosis. However, we have some loose medication in the public, in which case a 4-in-1 medication are sold out like individual medication. So you are supposed to take 4-in-1 drug and you are taking one. That also builds and contributes to resistance. And some of these drugs are also fake. And when an individual take it for 6 months, it's also not going to have the efficacy that it's supposed to have, and it's going to contribute to resistance. That person will feel a temporary relief, but that thing will come back in the future and will be coming back as a resistance form of tuberculosis. So regulation is very important. Monitoring of this outlet is also very critical. And after doing this, we will be able to get rid of resistance form of tuberculosis.
Dr. Victor Adepoju, Project Director, HIV and Viral Hepatitis Self-Testing in Africa Project, JPHEIGO in Nigeria. Thank you so much for your expertise and time on the show. We really appreciate you.
Thank you.
All right, I have been speaking with Dr. Victor Adepoju on how to prevent and manage tuberculosis. Soundhealth continues with trending health reports from around the world. Please stay tuned. This is where we say thank you on today's edition of Sound Health. Remember, report symptoms early enough to the nearest medical facility near you. Do not self-medicate. For comments and inquiries, please send SMS to 08035826603 or follow us on social media at LTV Social, #Soundhealth. A sound health is a sound mind. Make healthy living your choice.